So we're now going to talk about how you troubleshoot any issues with the CPAP so that you become comfortable with a mask. It is important to realise that it might take some perseverance to get used to sleeping with a mask on your face, and that the comfort will come from habitually using the machine at night. One of the common problems that patients experience is that if they're using a nasal mask, that their nose becomes blocked or congested, or they might find that they're sneezing in the morning or developing a runny nose. This is particularly likely if you've been given a nasal mask, either a standard nasal mask or nasal cushions. The first way to deal with that is to try using a steroid nasal spray. For example, one that you can buy over the counter or one prescribed by your GP. Something like a mometasone nasal spray or a fluticasone nasal spray that is used for hay fever. If that is not effective in relieving your symptoms, the second thing you can do is phone the respiratory physiology department, explain your symptoms and ask for a humidifier. The humidifier is a circuit that has some water that moistens the air and makes it less likely that the air will irritate your nose and cause sneezing and congestion. If using a steroid nasal spray and a humidifier doesn't solve the problem and you're still having problems with nasal congestion, you can ring the respiratory physiologist to ask about being fitted for a full face mask. And this is a mask that covers your nose and your mouth. What do I do when the mask is leaking, you might ask?
If the mask leaks, you can pull the mask away from your face, allow the air into the cushion and make sure the cushion hasn't buckled. If that does not solve the leak, you can then tighten the straps, or you should wash the mask. Make sure you maintain the mask by washing it weekly using a mild detergent. Avoid anything like hand wash or shower gel to wash the mask.
Another problem that you may encounter is that you're able to fall asleep with the CPAP on, but then you wake up in the night with the similar choking or gasping sensations you had before using the CPAP, or you wake up in the morning finding that you've pulled the CPAP off and it's by the side of your bed, or your partner may say you are still snoring when using the CPAP. These are all suggestive of the fact that the CPAP is not set at a high enough pressure. What you then need to do is ring the respiratory physiologists and they will arrange for you to bring the machine in and have the pressure increased. And they may also arrange a separate CPAP titration study where you sleep with one of our variable pressure CPAP machines, and that study will determine what exact pressure your machine should be set on. So don't be disheartened if you are finding that you've pulled the CPAP off or you're finding that you're still waking up with the CPAP on. This may just be a sign that your pressure needs to be adjusted.
Sometimes when patients put the mask on, it does feel a little bit like their breath is being taken away, and that can make some people panic. In order to overcome this, the machines have a ramp setting. The ramp will start the machine at a lower pressure and give you a period of time before it's built up to the higher pressure, hopefully allowing you to fall off to sleep before you experience that sensation and it feels too powerful.
Some patients, however, actually find a ramp uncomfortable. They want to feel the sensation of the air blowing in and opening up their airway from the beginning of putting the mask on. If you feel the CPAP is uncomfortable initially, it is worth checking on your machine whether the ramp is on or off and altering it as necessary. Guidance can be provided if you phone the respiratory physiologists. So what happens if you are able to use the CPAP machine comfortably? Your respiratory physiologist has told you that the CPAP is set at the right pressure and your mask isn't leaking, but you're still having broken sleep during the night and you're still feeling sleepy during the day. It is possible that you have an additional sleep problem, and what we would like you to do, if you haven't got a clinic appointment in the next few weeks, is to contact the respiratory consultant through the secretary, and they will arrange for you to have an additional sleep study done so that it can be decided whether it might be appropriate to recommend a different type of device with your mask.
So, the CPAP mask is only designed to last for a year. In order to maintain it, to keep it lasting that long and maintaining the seal, you will need to wash the mask with washing up liquid once a week. Avoid using hand wash or shower gel or baby wipes or anything along those lines. There's also a filter in the side of the CPAP machine, and that is to remove any excess dust. That will need to be changed at least 6 monthly. When it looks like it's dirty and it needs washing, please contact us for both the mask and the filter, and we can post them out to you. Or if you're coming in to see the consultant, bring your CPAP machine with you and it can be serviced at that point, and any replaceable parts can be replaced.
So I'm now going to talk to you about informing the driving authorities about your diagnosis of obstructive sleep apnea syndrome. The clinician that saw you in clinic should tell you whether you need to inform the DVLA. Patients with moderate to severe obstructive sleep apnea syndrome with daytime sleepiness, whether or not it's in front of the wheel, need to inform the DVLA once the diagnosis has been given. Patients with mild obstructive sleep apnea syndrome need to inform the DVLA of their diagnosis if within 3 months of starting treatment they still have symptoms of sleepiness. Lots of patients say that they never feel sleepy in front of the wheel, and therefore they don't understand the reason why they need to inform the DVLA. It has been shown from studies that patients with obstructive sleep apnea syndrome do less well on simulated driving tests, and they have reduced reaction times. So even if you don't feel you're necessarily at risk when you're behind the wheel, there is a small additional risk until you're treated. And that has to be borne in mind and explains why the DVLA requires you to inform them of the diagnosis. The way to inform the DVLA is to either download an SL1 form from the website or call the DVLA and ask them to post you a form. The information that you need to fill out on that form should all be available from your clinic letter, but essentially it asks for the severity of your sleep apnea and what sort of treatment you're being given. And if you're watching this video, you will have been given CPAP therapy. Once you've completed that information, the DVLA will often write to your clinician and ask whether it's true that you've been provided with treatment and you are undergoing surveillance. The clinician will contact you if they need any further information about how you're getting on with your treatment, but they will then complete the form on your behalf. It is very unlikely that you will have your driving licence revoked unless you are very significantly sleepy, you're not able to have any treatment or you're not responding to treatment, and in particular if you're a professional driver. The vast majority of people retain their licence without any problems. The reason that it is important that you inform the DVLA if you are told that you need to do so is if you have not done so and you were to have an accident, even if it isn't your fault, and the accident is severe enough for your medical records to be revealed, if it shows that you have obstructive sleep apnea syndrome and you haven't informed the DVLA, the insurance company may not provide you cover. So really informing the DVLA is to protect you and your insurance policy. It is of course important that you do not drive when you're sleepy for your own personal safety. So we've now told you a little bit more about obstructive sleep apnea and CPAP. We've shown you how to assemble the machine and fit the mask. We've given you the information you need to troubleshoot any problems so you become comfortable. We've also told you when you need to contact us for us to help you. If you're watching this video in hospital, you will now be fitted with a mask by a respiratory physiologist, and they will use their expertise to choose the right mask for you. After the mask has been fitted, you will have an opportunity as a group to ask questions from the physiologist. If you prefer to ask a question in private, you can stay behind at the end and ask the physiologist then. Before you leave the session today, we will give you some written information. For example, we'll give you the links to this video, so if you wish to watch this video at home when you go home, you can, and you can also show it to your partner. We'll give you some written information about the tips if you prefer to read it rather than hear it on the video. We would also like you to buddy up with at least one person in this session today who's starting CPAP, so you can provide some more informal support for each other and talk through problems. That might just help you get to using the CPAP comfortably sooner than if you didn't have a buddy. It may also be useful for spouses to make buddies to discuss the situation with their partner requiring CPAP. We'll leave that up to you, but support is really important, and of course we're always there to support you. You just need to reach out and contact us on the numbers given. I think the really important thing to remember is that CPAP is a very validated treatment, and there are thousands of people in the UK and across the world that are using it successfully. It can sometimes take a short while for the teething problems to be worked through, But the benefits from CPAP in terms of your daytime functioning, your alertness, your mood, your memory, your concentration far outweigh those small teething problems. We really hope that CPAP is going to be a positive experience for you, and we will do everything we can here at Harefield to make sure that it is. Please do reach out to us if you need any help.